Yes. I'm Dr. Scunziano. Anybody here new for the first time? No, new for the first time? Hi. Welcome. Welcome to our center, the WellCome Om Center. And most of the rest of you, I guess, know me in one way or another from something or other. I'm glad to have you all here. We have a topic tonight that I'm sure most of you are either pissed off about or want to get to the bottom of. You're kind of sick and tired of this whole inflammation word and concept that's going on, and it's a buzz right now. Everybody's talking about inflammation, and it's something to be concerned about. We need to know, what to do about it, why it happens, and there's just a lot to be said. I mean, it's a tremendous topic because when you think about it, just about everything in this world can be set afire. There's all kinds of flammable materials. We are inflammable, and I mean we are. I should say that we are flammable, and we're in flames. I got to get that straight, right? Inflammable, flammable. So inflammation is kind of having the flames come, intensify, and we want to make things inflammable. That's the opposite, right? So for the most part, we do have a lot of factors in our environment that would create this inflammation. So I just want to take a moment to say thank you to my technical crew, Sean and Jason, and Mary and Diane, and my team here at the Om Center that makes this all possible, helps me out. So I can get this done, because I can't do all of this myself. Most of us can't do everything ourselves. We need help. So thank you to all of the crew. And to all of those who are viewing in, who are tuning in, welcome. So again, this inflammation, the buzz, what is it that we're concerned about here with inflammation? Does anybody here have a good definition of inflammation in their heads? Anybody want to call out what inflammation is as far as you're concerned? No, huh? Nobody has a word to say. It's all me, huh? I'm talking, okay? We got to get you involved here. So anyhow, I'll go right on to, you see the disclaimer and all that. We'll talk about what it means to you, how it is in your life, how the flames are in your life, and how do we recognize that we're inflamed, and things that we can do about it, right? So here's a little definition in case you forgot or never thought about it. So really, it's the response of the body to something noxious, and that something can be intangible, and oftentimes it is. Bad thoughts, bad vibrations, fear, these anxiety-provoking scenarios and situations. So your body, even before you are conscious of this which will incite inflammation, the inflammation is already going on, in case you don't know that. Before you're even consciously aware, your body's already there. The cells, the energies of your bodies are already there, knowing what to do under normal circumstances. Now, if you are a person who is inebriated, kind of walking around drunk, or you are in an altered state of some sort, mind-controlled, you generally know exactly, your body knows exactly what to do. But if you are under the influence, I should say, of something, your body may not be able to take care of things so quickly. And that would lead to the detriment, the true detriment of the organism, you being the organism. Any animal that is under a drug or has something that's happened to them, stunned them, will not be able to defend themselves the proper way. And the defense system, which we call in our bodies and in the animal's bodies, the immune system, will not be able to do what it has to do in the most efficient way. When we're under the influence of something like a drug that can alter us, so we may not be so sensitive. And that would really impair and interfere with our immune system. Or if you have a metabolic dysfunction and your body is so out of whack because you have too much inflammation to begin with through various things like food and anything that goes in and enters in through the mouth. That's the main culprit. That's the biggest problem, as a matter of fact, for most of the body's inflammation. So when the body is altered, it doesn't have the snappy, right onto it ability to defend you so well. So if I can say, if you've been injected with something, anything that can alter the body, you may not be able to defend the body after there hasn't been an alteration in your immune system. Okay? I'm just going to throw that out there. And some of you may pick up on what I'm getting at. So if we have something in the body that throws off the immune system, our immune response to various other things, or just things in general that might be noxious and infective and so forth, we may not have the right response. So there can be an alteration in our immunity, or alteration in our response. So normally, our inflammatory response to some noxious agent, be it an injection, infection, a fearful type of situation, something where you're frightened, scared, something terrible happened, your body reacts. And it reacts with that which we call inflammation. So it could be an acute, and most of the time we have acute situations. That is, something suddenly happens and your body's reacting. Now, remember I said, your body's already reacting before you're even conscious of it. Think about that for a minute. Your body already knows what is going on before you even have a chance to think about it. So, say there's a fire, and you sense it, you smell a fire. All right, before you even think about it, your body's already gearing up to attend to that fire. You may hear a moan, a groan of somebody in your home, or a little cry out. Before you can even think about it, your body's already responding to it. Okay? You get the idea? We have intelligence that is beyond the conscious knowing. We react, react accordingly. So the reaction of the body to a sensed sound or scent or visual or something that is palpable, it's already working. So if there's a mold in your home, you have mold, right? Your body's already reacting to it. And then what happens is you may not recognize it. So we don't exactly sense when there is an acute problem. The problem starts to insidiously build in our system. And then you start to feel symptomatic, like, you're getting headaches all the time, or you have, you're starting to sneeze, your nose is always clogged. Something's not right. Your brain is foggy. Your body's already been detecting that there's something wrong, and there is an inflammation building up. So the cells of your body are starting to figure out there's a problem here in the environment, there's a problem here. But it may be, if you're that insensitive, remember I said before, when we are exposed to things, our body already knows, but the body may not be giving you an automatic signal, especially and most often when the body is dysregulated or it's been altered. So if it's already altered by something, say you have diabetes and you have neuropathy and you're on medication for that, and on top of that you have blood pressure medication because your blood pressure is also out of control, and then you're on something else for the neuropathy and you're taking one thing after another. Your body is not so sensitive, but at the same time, something is already in process. Inflammation is still there. Now, the inflammation of the condition that you have, be it diabetes or hypertension, that in and of itself is an inflammation. And then on top of that, your exposures are to mold or something else. And it's all reacting, and it's all happening together. This is where we get into chronic inflammation. There's a chronicity there. No, under normal circumstances, if you have an acute situation and somebody has got, something that happens like that, like you get, there's a burn, or you get burned, or you have, you took in some bad air and you inhaled some toxic fumes. Your body goes into a state of acute inflammation. So it gets ready to protect your lungs and your eyes and your heart. So we go through this process acutely, and then it dies down as the body takes care of it. So your body's so smart, it's going to make sure that it gets rid of, or it takes care of whatever it has to take care of, the fumes, the this, the that may have come into your nostrils or around your face. And then, then everything is secreted. Proper adrenal hormone response comes, boom, boom, boom. We have the adrenaline comes out, the cortisol comes out, everything comes out to expand your lungs so that you can breathe easier, so that you can move quicker if you have to. So you kind of go into that fight-flight, right? So your body's doing what it has to do to clear up the situation, and then it quiets down. That's what we call acute, and then an acute inflammatory condition, and then there's a quieting down. After it's all done, okay, I can breathe, I'm fine, everything's okay. My lungs opened up, I'm okay. But I'm not going to go back in that area anymore. I'm not going to go near those fumes anymore, right? You hopefully learn your lesson. Okay, but that's a simple kind of scenario. You go through a little acute situation, and your body kind of resolves it. You walk away from the situation. It happens all the time. We're exposed to something. A bee sting is an acute inflammatory response, right? A bee sting, a bite from a mosquito, whatever. The dog bites you. You're going to go into an acute inflammatory condition. The cells come right away to fix what has just been insulted. Immediately, even before you can think about it, your cells are already fixing that problem. If there's blood associated and you're bleeding, the body's trying to stop the bleeding so that you don't die. Okay, anything to preserve you is happening. So these are situations where there's inflammation that goes on acutely. Even when you're in the car, you're driving the car, and then and you're in the car and somebody cuts you off. What happens? You are put in an acute inflammatory position right there, because everything just rushes through you. This is not like unnoticed. The body is already knowing what to do even before you think about it. I'm just going to keep repeating that. Your body knows already. That's why it's important that you consciously know what you are in the middle of, what your situation is, your position in space and time, so that your body does not have to be always ready to jump. Because if it's always in that state, we call that hypersensitivity, hypersympathetic activity, constant stress, constant inflammation. So it's just not where you want to be, because it's going to lead to illness. So we have acute, I gave you a few examples of acute. The dog bite, the bee sting, you get scared, you're on the road, that kind of stuff, okay? And that usually you calm down, right? I'm sure you've all been in one of those situations. And if anybody hasn't, you need to leave. Okay. You're not normal, okay? All right. No, I'm not normal. But we have to now look at something that is very important, and that's what I have to focus on, and that is the chronic inflammation that we are exposed to, or that is happening on a continuous basis, that's leading to just about everything that's wrong with your life. And so if we can slow that down or prevent it, that would be the goal. All right? So disturbances in the body can be continuous, and you're not even recognizing them. You're just going through these motions every day. You're getting annoyed about this. You can't stand the news that you hear. This one is not right. I hate these people. I don't like what's going on. I'm this, I'm that. My kids are driving me crazy. I don't want to take care of my mother anymore. Whatever, right? You're just constantly being overstimulated, and the flames of aggravation are continuously roaring inside your body. They just keep going. And, you just keep doing the same thing over and again. You keep eating the same kind of foods, or you go and indulge in something that you shouldn't, be it too much of this or too much of that, or alcohol, or you start smoking, or you keep smoking till you can't even see the room anymore. The room has gone up in smoke from your cigarettes. These are chronic conditions. So the chronic inflammation will lead to disease. And it's not only, again, the scenarios of being aggravated and having all these things happen to you, as far as, mentally, you're physical, and you're physically in the middle of something that's mentally driving you crazy. There's also the substances that get injected and put into our bodies. That's something that I'm bringing up. I will bring it up because it's very relevant, and so hear me out. But first, let's just know the difference between the acute, and then you go into the chronic. So you can have an acute on chronic, you can have another acute, and you still have that chronic underlying inflammation going on. All right, so these things, if you want to just take a look at, take pictures of. Don't forget to put your cell phones in airplane mode, by the way, if you haven't done that already. But these are the things that we are exposed to. Now, here's the other item that I would like you to be aware of, and very aware of. The toxic materials that you're exposed to on a daily basis. It could be pesticides, chlorine, fluoride, artificials, polyfluoroalkyl substances, PFAS, and all that. All these nasty things that come from our foods, and the cellular devices that we're using, these are constantly invading our energy fields, creating constant inflammation. So this is where we have to go, knowing that your body is constantly being aggravated, and you wonder why you don't feel right? Chronically being bombarded with these things that your cells, your brain, and the whole of the constituents of the body have to figure out what to do with, because it's constantly happening. When you have a cell phone in your hand all day long, you're just basically inflaming the body more and more. You're fanning the flames to diseases that are going to develop. When people come in and say to me, my brain is foggy, my arm is burning, I can't breathe right, I'm having palpitations, where is the cell phone? How much are you using it? Is it in your hand or in your pocket all day long? Is it on? Is it live? Most of the time, the answer is yes. So if you think that's not contributing, think again. There's enough science now that will validate the fact that cellular, Wi-Fi, all of that artificial stuff is right here, right now, in your hands, radiating you again and again. And so I tell people, please, and I've said this so many times, if you don't know how to use this thing and you don't use it safely, you don't deserve to use it. And it's not even a matter of deserving. You shouldn't have it. You shouldn't have it. It doesn't belong in your hands. It's a weapon. It's a weapon. Does anybody disagree with that? Does anybody understand what I'm saying? Yeah. Okay. So, but we keep doing it. And if I tell someone, please don't do that, oh, but I have to use it for work, I have to. What do you mean you have to, okay? If you have to use it for work, then it needs to be, in a specific place off of your body, and you need to use something else, perhaps to protect yourself, perhaps a garment or shield. My son bought me a shield, thank you, Sean, that I brought with me to a place. I had to go to a conference, and I went to a hotel, and I actually slept with this thing on over my head and across my chest and vital organs. Okay? Because when you go into a hotel room, don't think it's pristine and it looks nice, all clean, nice custodians and all that. They did a nice job. Pretty. I go into the thing like you're putting a what do you call it? What is it that Serena said? You're sliding in under the sheets. The sheets are so tight. You're trying to get into the bed, right? It's a room that is going to be irradiating you. Okay? Inflammation. You don't even realize it. You wake up, you got headache. Why do I have a headache? Why don't I feel so good? A friend of mine was in a hotel at a higher level. This is another thing. Beware. On higher levels of hotels and buildings, you're going to be irradiated much more, because that's where cell towers are coming right through. They're coming through the higher levels on these buildings. And his whole team that he was with, he was attending something, they were all sick with headaches. They hadn't had them before they got in the hotel, and they all they were all sick with headaches, and brains were not right. And they went down to the lower levels. They had to ease their pain in their heads. They were not right at all. So they put two and two together right away, because he's someone who understands this. And so, a lot of people don't get it, don't know this. It's not like, you have a sign in the hotel. The rooms are pretty much electromagnetic intense, so be aware. You're not getting those warnings. You're not getting those warnings really from anywhere mainstream or in any of these places, hotels and so forth. If you go to a conscious hotel, anybody know of one? where they'd be concerned about your brain well-being, other than your comforts of the nice room and all the amenities, da-da-da. You've got to understand this, folks. You're around the most intense ever degree of radiation. And the more you are aware, the safer you can make it for yourself. So you have to make appropriate accommodations for yourself. So please be aware of that. I'm not going to go beat it to death, but it's important because it is a big source of inflammation in the body. A couple other things here. Let me just stress. In food, alcohol, drugs, smoking, so forth. Okay, you take too much in what your body does not need or want, you set yourself up for a big inflammatory condition, where your body now has to figure out what is going on here. You'll generally end up with some type of indigestion, small and large bowel problems, which leads to, or can lead to, leaky gut and other things which contaminate your bloodstream, leading to all kinds of ugly symptoms like brain fog and fatigue and your hormone instability, your inability to properly process your food, and so on and so forth. So you become dysregulated. You just start to fall into a dysregulatory pattern, and your body's just like, are you going to let up on this? Are you going to give me a break? Ever? So, if you're in that situation where you're doing too much, you're going to need help. You need help and guidance. Most people who are, having these problems with overindulgence in any of these things, need help. It's very, very, it's rare that somebody can just say, oh, okay, I made a mistake. I got to just get myself together, and boom, he's on a new path of new life, clean up, So counseling, therapy, whatever. We do that here. Diane and I do that here. We can help you if you need it. Lack of sleep. Another situation. Everybody's been there, right? It's pretty bad. It's pretty bad when you can't, give your body that right time that it deserves to sleep. Or why is it not sleeping? You're trying, but it's not happening. You have to figure that out. Or have somebody help you figure it out, because oftentimes you don't know. And I have this all the time. I can't sleep. I've tried everything in the book. I've thrown the whole book at my insomnia, and nothing's working. But then I find out certain things that are going on, and I just have to do a little investigation. I have to do my little detective work, and then I'll find out. We'll find out what's wrong. But again, if you don't sleep, the body's constantly in a state of hypersensitivity, neuronal activity, so the brain is always going, and then you're secreting certain hormones that are preventing you from burning up your calories, so people end up, hungry, because everything is stored, and then you get hungry, and you have certain hormones that will keep that hunger going, because your body thinks that it's in a desperate situation, because it needs sleep and it needs nutrients, and they're not being released properly that are stored. So it becomes a vicious cycle, right? There's a lot of anatomy and chemistry and everything that goes into this, and I don't have the time to talk about all of those things, but just know that when you're in a state of anxiety or you're depressed or you're uptight or you've gotten yourself into some bad habits, you're going to need help, right? You're going to need help, and if your partner or your friend are not able to help you, you have to seek other help. So that's where, people like myself, Diane, we're here to help, okay? And I want you to be aware of that. And again, we're not the only show in town, but you do need help. If you can't get off this this crazy roller coaster or cyclic up and down, inflammatory state, you need help. Face it, it's okay. It's okay to ask for help, and you should get it, because otherwise it'll lead to something else, which will lead to something else, and so on and so forth. Okay, so here are other things like military. Anybody here? Veterans? Any veterans here? Thank you. We know what you went through. I know what you went through. I mean, I hear it all the time. Chronically stressed in that time period. Sir, what service? What was the service you found? Army for how long?
2 years.
2 years, and that was how long ago?
In Vietnam.
Wow. 2 years Vietnam vet. Thank you for your service. Yeah, so that is a state of inflammation without question. Here he is, constantly hypervigilant, always on the lookout, worried. You guys, you sit in a room, you have to see the door. Every one of you have to see where the door is, right? Always looking for a way to get out and to get help, So I've heard all of this, and I've heard it again and again. So always in that hyped up state. That hyped up state then leads to trouble if you don't get out of it. If you keep on it, in it, your body in that state of constant stress, fight, flight, that's what's going to lead to trouble. And that trouble then turns into diabetes, high blood pressure, sleep apnea, Parkinson's disease, thyroid disease, arthritis, neuropathies, impotence, you name it. It's all happening. So until we get the flames down and or put them out, we're going to have that chronic condition. That's going to lead to several problems. So here, again, the constant stress of a situation at home, at work, or otherwise is a very common cause of chronic inflammatory response of the body cells to be traumatized. Literally, you're going through trauma. If your body keeps at a scenario, a situation, you need to resolve it. Okay, so what else can cause inflammatory processes to go on in the body? As I mentioned before, medications, whether they're oral, topical, injectable, you name it, they can cause inflammation in one way or another because they don't just go in there and just happily go to the problem. There is a shifting, a shunting, a blocking, a transformation. There's all kinds of stuff that can happen with medicine, and it has all kinds of side effects. And with those side effects come inflammation. Your body has to deal with the side effects. So they seize this foreign substance, because most medications are synthetic and they're foreign to the body, but they're made so that the body doesn't totally reject them. So there's a careful strategy with medications, pharmaceuticals. They make sure that it goes in and generally doesn't cause too much trouble, kind of gets the job done, but then it can cause a lot of trouble thereafter. And then whatever. Then you're hooked on the medicine, you try to take it off, can't do it because you feel terrible if you don't take it, right? So all kinds of weird stuff happens. Yes?
What about vaccinations? Cause the same problem?
Yeah, vaccinations, yeah. You get me started on that, we won't leave. A normal vaccine, right. So you could have a response to that. Again, many people have had effects from shingles or flu or, any number of those things, influenza, hepatitis, and then, of course, the latest, which is, again, unmentionable. Right now, maybe, but I'm going to get, believe me, I'm not done with that. We're going to get there at some point. Okay, so medications have that effect on you. So I want you to be aware. Don't think that these things are just innocuous and you just go in, I'll take some ibuprofen, no big deal. Ibuprofen will affect your kidneys. Ibuprofen will affect the lining of your intestinal tract. Okay? And it sets up some inflammation right there. So it's used to reduce inflammation. It's setting it up. Crazy, right? But that's what happens. Supplements, if you take too much, or if you're sensitive to something in the supplement, that can set off a cascade in your body too. So, you have to know what you're doing. Seek some guidance on supplements. Don't just put anything that's on sale at CVS or Target in your mouth. Oh, it's vitamin D. Oh. The best vitamin D you can get is up there. That's the best. So again, all these things can predispose you to trouble. So it's really the inflammatory condition that which sets your body in a state of constant irritability. While you may feel irritable after your body's been irritable for a while. It's generally not the other way around. It's not like I'm irritable and then my body gets irritable. No, the body's already irritable and then you start to feel the effects. The gut and the brain are working in complete oneness. So when this is not right, this is not right. So we kind of put it up here. But our cells are really all coordinated together. So the toe cells and the cells up around your brain, they all know what's going on. So they're all working together. But the gut is the site where most things happen to affect the brain and every other organ. So please be aware of what goes into your guts. I see people tell me, I had some people come in and see me, and the gentleman of the couple has everything under the sun wrong with him. Everything. And then I said, okay, tell me about drinking and smoking. Oh, we have our cocktails every day. And first of all, this person is full of inflammation. Totally. Chronic disease all the way. And the cocktail, they shared a bottle of wine last night. It drank the whole bottle. I said, sir, there's diabetes, there's chronic arthritis. You're drinking wine, and have no idea. They're smart people, but no idea that the wine, the alcohol, is breaking the brain down as it's breaking down the liver and the GI tract in general. No idea. Thought it was great. Oh, it's calming us down. What? So again, if you don't know what you're doing, and so many people I find are clueless as to what's really happening, this is trouble. This is trouble. You're not being told. You didn't learn these things in average school. When you went to high school or whatever, or grade school, high school, even university, unless you really learned what true nutrition is and true inflammation, where it comes from, you have no idea. Nobody's talking about it. So again, it's very important that you get tuned in, clued in these type of things that I talk about. I'm just giving you an idea, giving you a taste of what should be known, should be taught. That you all should be able to take and share with your families. Okay, so and the bottom line, we have dairy, meat, poultry. Okay, I'm going to tell you something that you may not know right now about the dairy, meat, poultry, livestock, all that industry. They are now putting certain vaccines into the livestock. They're doing it. They've been doing it. And any imported meats that are coming from other countries, whether they be pork or, cattle, beef, they don't have to be labeled that they're from other countries. They get a USDA stamp on them. And you do not have any information about what has been fed or injected into those animals. Just a little food for thought in case you're all you hungry meat eaters want to continue to indulge in whatever's out there. You need to know this. If you're not raising your own cattle and livestock and whatever that's running around your yard, you have no clue. And I found this out, and it was a physician who was like on a board in the cattle industry. And he's pissed off because certain governing bodies protect certain peoples and whatevers around the world, and the United States Agricultural Department. There's all kinds of rules and this and that people skirt around or, get through. So your beef, your this, your that you may like, you have no idea what its contents are. All right? And now it's a time of inject, inject, inject. And it's coming into the food, my friends. Yes?
I have a statement and a question. In relation to the meat,
Yep.
the rest of the world doesn't accept American meat anymore, particularly Europe. They stopped the import of meat. So that's the question already solved.
Yes.
The question I have, what do you consider high sugar intake?
I'm sorry, say it again.
What do you consider high in sugar intake in terms of the doses or whatever?
Hi. Sugar, did you say sugar?
Yeah.
Oh, okay. I'm sorry. I thought you were still on the meat. Like, I was like, what? High sugar intake. Okay. All right. Yes. The sugar, according to the American Heart Association, for a female should be no more than 24 grams of added sugar per day. 24 grams. What is the average 12-ounce can of Coke in grams of sugar is there? Does anybody know what's in that can of Coke? Grams of sugar? Anybody? Okay, so it's something on the order of 40 to 60, and I'm not sure if it's 12 ounce or 16 ounces. Those cans, I don't even know because I don't do them. So whatever the can size is, you're generally going to have, on average, about 50 grams of sugar in there. Now, I just said that a woman should have no more than 24 grams, and that is equivalent to 6 teaspoons a day in anything. I'm not talking actual teaspoons. You may be doing teaspoons, but whatever's in those processed foods and any other sugary, item that you like, if you're having 6 teaspoons a day of that, you're exceeding or you're going to be entering into a danger zone. For men, it's 36 grams. That is 9 teaspoons of sugar. They would consider that's where you're at the point where you're going in the wrong direction. So for males, it's 36 grams of added sugar a day. And again, to me, as someone who's got myself involved and versed in nutrition, that's way too much. And for a woman, it's approximately 12 grams less. But still, for a woman to be 24 and a male to be 36, I mean, these are allowances being made, but they are wrong. It's just like in the cellular world, there is no safe degree of radiation. And what are our thresholds here? Way too high. Allowances are made for so much. You're getting bombarded every minute of your life. If you're in Wi-Fi most of the day, if your home is Wi-Fi and your office is Wi-Fi, or wherever you dwell, you need to go to the beach. You need to go to your outside, pitch a tent, because if you go inside, there's Wi-Fi. So these, again, these allowances that are being made are not helping us. They're sort of, these are the guidelines. But really, folks, you know what the RDA for iodine is? Anybody? Does anybody know what iodine is? It's an essential nutrient. You need it, okay? If you're getting nothing, virtually nothing, you're in trouble. So we need iodine to help us, to prevent inflammation. We need iodine, okay? 150 micrograms is the RDA, which is really basically nothing. It's not protecting you against cancer, which it can do if you took a better dose of it. So a little bit more, folks, should be taken every day or as often as you can. 150 micrograms is a very small amount. Yes?
What is iodine and salt?
Iodine and salt. It depends on the type of salt. Now, you got a zillion different salts. You'll have to look on the label of the salt. If it says iodized salt, it usually gives you some idea of the percentage of iodine that you're getting. If you're taking table salt in a restaurant or out and about, it's generally zero, void of iodine. Don't think you're getting iodized salt when you go to Carrabba's or one of those places, your favorite place, Bonefish. These are non-iodized compounds on the table. They could be very high in sodium, but they will be absolutely devoid of iodine. So you want to get something that says iodized, and then you have sea salt. People ask me about sea salt. Okay, sea salt has a small amount of iodine in it. And like a teaspoon of sea salt may have anywhere from 10 to 15 micrograms of iodine. So this is a very, very small amount. So it's better for you to look for other sources, a sea vegetable, a seaweed, fish, and those are the big ones. You may get some in your mushrooms, some cranberries, but I don't trust it. I don't trust it because again, they're not going to tell you how much iodine is in in a bag of cranberries. You're not going to see that. You're going to see sugar, you're going to see fat, see calories, but you're not going to see iodine. Over here in our little shop, we have Maine Coast sea kelp. I've been promoting that little product for a while. I'm getting nothing back. They should give me a shipload of it for free because I'm telling everybody to try it and use it. I use it myself. It's organic. It's sea kelp. It's granulated. Some of you may know the product. It is very helpful for thyroid function. It is very helpful to reduce inflammation, by the way. And I'll get to that in a minute. So let me keep going here. A lot of these weird oils that get thrown into packaged food, sunflower, safflower, canola, grapeseed, they're high in omega-6 fatty acids. These can actually set off inflammation in your body. Your body's trying to deal with these products that start to accumulate, and it's not fun because you end up with painful joints, gain weight, slow down, fatigue. These are just some of the symptoms that'll happen when you just take so much of this omega-6. And the omega-6 that's in there is linoleic acid and cause a lot of trouble. And linoleic acid is quite high in poultry, by the way, in chicken. All you chicken lovers, you're going to grow feathers and you're going to be inflamed. So don't do it. So we don't want all those crazy oils. So there are better oils. So, okay, I will give you the better oils. I just got to check my time here. Okay. If you don't take enough minerals in, there's mineral supplements. These are nice to do. It's nice to take a multi-mineral. Low fiber, okay? When you don't do fiber, you don't do all your vegetables and good quality fruit and grains and things like that, you're not taking in enough fiber. The best, I should say, a diet that would be best would contain at least 50 grams of fiber a day. The average American, the average person living in this country, is getting around 10, maybe 20. And that means there's a deviation. So that means there could be, if the average is like 10, 15, then a lot of people are hardly getting any at all. And then you have those who will get more. The more you take, the better. There are countries and places in this world where people eat 100 grams of fiber a day, and they're some of the healthiest people around. All right, so what are the symptoms that we have when we're inflamed? Voila. Pain, trouble in just about every aspect and every organ system, your skin being the largest organ, but you're going to have all of these strange feelings when your body's inflamed. And you may not know what's causing it, but I'll tell you, it's multifactorial. There's so many things that are inflaming the body. So if you have any of the above, if you have at least 3 of these, you're inflamed. I mean, if you have one of them, you're inflamed. But if you're chronically having these symptoms, these are not good signs. You don't want this. I mean, how many people here have none of these symptoms? Okay? Doesn't say much for our health, right? A healthy individual has no muscular pain, is feeling energetic, has smooth skin under their eyes, has good teeth and gums, feels strength, is not numb, doesn't have any tingly, wingly things. Everything is moving. All the joints are moving, right? The stomach feels great. There's no farting all over the place. There's no having diarrhea and constipation and all that stuff. There's no infections, right? How do we define infections? Anything that will create pain and pussy kind of situation. Again, if your infection's in your lung, it could be the sputum is the pus. If there's infection in your bladder, what's coming out of in the urine is just pus cells, like our white cells and so forth. It's really a pus-related thing with the infection. And men should not be having trouble with their erections, and men and women should not have a lack of interest. You should be interested in life, have a libido, which means you want to do things. You're excited about things. You should not have to be gaining weight. And you should be in a happy, peaceful, joyful state. Now, wouldn't that be nice? That whole list reversed or opposite. So think about this. So we do things in our field. The people like myself, these are tools we use, but there are more tools, and it's basically I just ask questions, and I kind of do an exam, and I touch your skin, and I could see the inflammation right in front of me. I don't even need these things, but we, of course, you go to a standard doctor, and things are done, endoscopies and so forth. Okay, so let's go right to what we need to prevent and avoid. Toxic materials, just too many. There are just too many on that list of toxins. So basically, toxic materials are everything written below the toxic materials. But, of course, toxic materials include that which are non-edible and your carpeting. Think about your carpeting before you buy it. Think about what materials you're putting in, what you're furnishing with. What kind of materials are you eating with or cooking with? Are you cooking with coated pots? Are you using aluminum? All right, in case you didn't know that, aluminum's pretty bad for the brain. Your coated pots, not too good, not at all. Plastic, how much plastic are you using? I would like to say this. All of you who are carrying around plastic water bottles, shame on you. You need to get your water, get it from a good source, whatever that may be, put it in a container that makes sense so that we don't contaminate our bodies because you get the microplastics in your body. And, that water could be hanging around in a car, it gets heated up and this and that. That will make for more trouble in the water that gets into your body. But then what do you do with the plastic? You throw it in the garbage. Maybe there'll be a recycling receptacle. But then I'm hearing that these things are not even being recycled. You go to a recycling center, well, where is it going? I'm confused. So let's be smart and protect ourselves, which means protect the environment. It's kind of one and the same. If you protect yourself, you protect the environment. So what you put in your body and around your body and that comes out of your body is not harmful to the outside world. And then keep doing that. Keep doing that. Reduce your inflammation state. Avoid these products that say 0, no sugar, low fat, all that stuff. Artificial and dangerous. Does anybody know that Splenda, you know that lovely thing called Splenda? All right, so what is the generic name for Splenda? You might see this on your labels. Okay? Sucralose, right? Sounds very much like sucrose, but it's not quite. It's not quite, because what they add to the molecule, which is your carbohydrate molecule, they put this little sucker in there. Anybody see what that is? Chlorine, right? Now, what did I mention before? I mentioned other toxic materials like chlorine, fluorine, all of these things. Fluoride doesn't belong anywhere in anybody's mouth, by the way, or in the water system. Toxic. We've already got some chlorine in our waters. And this is put into sucrose. It's added to the molecule of sucrose, which is your sugar, which comes from natural sources. You'll have it like in your in plants and this, that. So sucrose, they add chlorine and they make a new product called sucralose. That chlorine will alter your microbiome. Everybody knows what that is? And lead to a disruption in the brain from that. Okay, so it's like there's chlorine. It's like drinking your pool water if you use chlorine in your pool. Okay, so you just keep drinking that stuff. You're going to see what happens. It's not too good. It will lead to visual disturbances and other things. Seizures, GI disturbances, that's a given. The studies that were done on this product, they tried to bury the data. Does that sound familiar? Bury the data on the dogs that were given this substance. The dogs developed tumors and more tumors, gut disturbances, they died. But guess what got put onto the market? How splendid is that? We have an artificial sweetener that can destroy us. And the one before that one, in case you didn't recall, yeah, what is it? Anybody who's still using this product under the with the names NutraSweet Equal, you've got to be kidding, okay? And if it's on the table at the restaurant or in your home that you're offering to people, shame on you for touching it, buying it, anything. This, together with this lovely substance, is in the yellow packet, in case you need to be reminded. This one is generally in the pink or the blue packets. These are excitatory molecules on the brain and have caused seizures in the people who keep drinking this no sugar, low sugar item. All right? So you need to know this, and these are some of the things that inflame the body and cause brain inflammation. Brain inflammation is not too good. Yes?
What is stevia?
Stevia is a sugar alcohol found in certain trees. It's indigenous to South America. They do use it. I would say use it in small quantities because sometimes it could be a little upsetting to the system. Any sugar alcohol, sorbitol, mannitol, erythritol, and stevia are, they're sugar alcohols. So they don't equal, they don't register as sugar in the body, but they can upset your body a little bit. But it's nothing like these two products. Be aware of that. Yes. Hi, Mary.
How do you feel about monk fruit or agave?
Monk fruit is fine. Agave, no. Monk fruit, that's another item that'll come in as a sugar alcohol. Not a problem because it doesn't register as sugar in the body. The body doesn't see it as sugar. But agave is full blast sugar plus. It's really like taking high fructose corn syrup. I don't regularly recommend agave. If you take, it's a little bit and you just touched it and you tasted it a little bit, okay. But don't be eating that as something that's full of agave and you're just eating it every day and all that stuff. No, please don't.
What about honey?
Honey, try to get local honey with the honeycomb in it. You get a little bit more nutrition with it because it has a few nutrients in it. So a little bit of honey, again, as long as you're not suffering with a sugar problem, it's okay. But if you do have a diabetic problem, you're pre-diabetic, stevia, if you must, stevia, monk fruit, as Mary said. Some people are using xylitol, that's the other sugar alcohol. I can't use it personally. Xylitol gives me mouth sores. I put it in my mouth. I tried some gum with it. Couldn't do it. So you're going to have to test the waters. It's not dangerous stuff. But you just want to not maybe take too much of it. And believe me, I'm like a canary in a coal mine because I'm sensitive to things. And when you're sensitive to things, it says something about whatever it is. I don't like it when, I know that this stuff can hurt people or potentially. So I'll say just take your sugar alcohols in a limited way. Don't have a lot. Okay? Xylitol might be fine in your mouth, but not in mine. But everyone's different. Everybody's absolutely different. Okay, let me see what we're doing here. Okay, so do feed the body probiotics with prebiotics like flax, chia. The prebiotics are the flax and the chia and the artichokes and the avocado and the allium and all that. The probiotics are the the fermented foods. The miso, tempeh, kimchi, they will give you the culture, the bacteria and so forth that's good for you. The prebiotics are the foods that feed the probiotics. Got that? It's pre for pro. And then there's postbiotics, but you don't have to worry about that. But pre is the food that feeds your little bacteria that are doing everything for you, making some really great products like butyric acid, which is very, very important, fatty acid that's necessary for membrane formation and all these other nice little things that are structural groundwork for your organs and membranes. So you need those little bacteria fed good food. The bacteria don't like pretzels, Fritos, ice cream, corn chips, French fries, and coffee. Right? They don't like it. So, but they do like these other things that I'm mentioning here. Okay. MCT oils, that's medium chain triglycerides. That's what MCT means. It is an easier fatty acid on the body. It's absorbed nicely. It's not complicated. It has a nice absorption capacity. So coconut oil is not a bad thing. You don't want to overdo it, but not a bad thing to take some coconut oil. I happen to like it and I use it. Okay, so if you're not exercising, you are not living. No matter what your state is. If you can't do certain things, well, do other things. You know what I'm saying? If you can't walk long, then swim or get on a machine that can help move you. And or you pull, push, so on and so forth. Do some resistance, get the body moving any which way you can. There are power plates, there are these cute little things you stand on and they vibrate you. Or if you just want to shake and shimmy and shake and shake in your place, you don't buy it, you just shake. Do that several times a day. Whatever it is that you can do to move. Movement is essential for life. That's the way it goes. In the book that I've written, and it's becoming updated, I'm doing a second edition of Be Consciously Healthy, there's a whole thing on movement in there. Whole chapter. I can't stress movement enough. Exercise will be saving your life. So 30 minutes a day, break it up. You don't have to do it all at once. And then there are people who overdo it, to 2 hours straight. You don't need that. The science is there. True science is there. So you don't need to kill yourself every day. And this whole thing of, I work out 3 times a week, that's not good enough either. Each day, dedicate some time to you. You, if you're going to take the dog out, that's one thing. That's not real exercise. That's watching a dog empty his bowels. Or sniffing someone else's backside, or whatever. You stop and go. That's not exercise. If you are running with a Jack Russell or a race dog, a race hound, up and down the blocks, that's different. That's different. I don't know that anybody's doing that. You might get arrested. I don't know. But anyhow, you need to do this. Movement. Sleeping, I can't say enough about that. You want to raise your leptin levels. When you sleep, there's a hormone called leptin. It keeps your appetite under control. So that's why we have to sleep. And if you don't know how to sleep, come and see me. I will tell you how to sleep. The sun is the key element here. The sun helps you sleep. That's a big point I would like to bring out. If you can get out in the sun, and you have plenty of it here in Florida, I think we're all, we're happy to have the sun here. It's doing you wonders. It does not cause skin cancer. You can throw that myth out. You need to, but people get worried, wrinkles. If you eat right and you take care of your skin, you moisturize it, 15, 20 minutes of sun a day is not going to give you wrinkles. No way. If you're in the sun all day, it's different. It's different. It's going to be drying up a little bit. And you'll get a little, you'll get that leathery skin, so I don't think that'll happen for you. Fun, recreation, laughter, these are all, everything on here is anti-inflammatory. Take down your irritants and put the right stuff in to prevent inflammation. Anti means against inflammation. Pro-inflammatory, I've shown you what are all the things that are plus. There's more stuff, I'm sure, out there. Pro-inflammatory foods, pro-inflammatory chemicals, toxic materials, negative emotions, irritating situations. The more at peace you are, the less likely you're going to be in these irritating and negative situations, and less you will attract them. Okay.
Question. What does that mean, solar power?
Okay, solar callus. Okay, yeah, I figured everybody knew what that meant. So, uh, that is, you sort of prep yourself in the mornings, like an early morning sun. 8 o'clock, 9 o'clock is not very intense, so you you can give yourself sort of a pre-sunning before you get into the hours where it really counts, because the strong rays, the UVB, is what you need to make your vitamin D, and it's not really happening at around 8 or 9. So in this hemisphere, in this zone, it'll be about 10 o'clock, between 10 and 2, and then there's the high noon, which is, I don't know, 12, 1 o'clock. Sun is right up, way up high. That's fine to be under the sun for 15, 20 minutes. And you don't have to just do this. You just take off all your clothes, run around naked, and you get all your suns. And it's actually better that you do, because your face is not really the ideal place to have all the sun come through. It's not going to take all that which you need. And so you need to expose your arms, your back, your legs, everything. All right? There's nudist people, they're in the best position, the nudie people. Nudist colonies, do we have any here? I think we had 1 or 2, right? Whatever. Everybody should do that. Everybody should be not worried about their skin. Okay, so foods, there's a whole line of foods here. So if you want to feel good, feel great, include these foods in your life. If you're looking to reduce inflammation right off the bat, omega-7s. And to lose weight, omega-7. Eat more macadamia nuts. Don't eat a pound of them, but put macadamia nuts in your body. You've got an omega-7. That's another one. People say 3, 6, 9, all that. The only ones you really need, because the others are just are the 3 and I recommend 7. In olives, olive oil, they will. I'm sorry, papaya, yeah. And if you have omega-3, you're set. So you don't need 3, 6, 9. Anybody who gets that formulation, it's a waste. You get plenty of omega-6s from your daily diet. It's coming in, and the fatty acids from meats, from different milks, there's just nuts. General nuts have omega-6 fatty acids. There are certain foods that have omega-3. Not everything has omega-3. So you may know that salmon and cod and tuna, they have omega-3s. Flaxseed has an omega-3, but they're different. Now, the plant versus the animal. The plants have omega-3 alpha-linoleic acid. That is plant. And the fish have DHA and EPA, and those are different. These are different acids that are very important, very good for the brain. So, and they're necessary when a baby is breastfed. Mom is giving this across the colostrum and all. That is very important for a baby's brain health. So that naturally comes with the milk, mother's milk. And if you have a formula, it has to be added in. They have to put DHA and EPA in the formula, because ALA is not enough. So it's good to get all 3. If you are not a fish eater, you don't do that, please get some oils that, maybe you don't like the taste of the fish. So you get an oil that's contained, that has, that you can swallow, and that has the omega-3, EPA, DHA. Yes?
Just get back to being out in the sun about 15, 20 minutes
Yeah.
a day. Is it better not to have anything at all on your body?
Correct. Right.
Don't put
Right.
just coconut oil on it, don't even do that?
No, yeah, don't do it. No. And if you would not, 10 minutes? Okay, thank you. If you would not or do not wash after that, it's better. It's better that you wait some time. Don't just go and try to shower after you've been in the sun, all right? Let time pass. walk around with your bathing suit or whatever, don't shower so quickly so that the sun rays can do their job. It's not going to just like be instantaneous and then run and then you go and clean yourself off. I've heard this from some science that it would be better for you to let the sun soak in for several hours. Some people even wait 24 hours before they even touch themselves, just to let that go in. Now, I have to see that evidence, but if you can at least get, the sun and leave your skin alone for a little while before you apply anything, then you can put some moisturizer on it if you want to shower. Then several hours later, you will put some nice natural moisture on it. That's fine.
Now, isn't it benefit to, like, before 9 o'clock, infrared light? Isn't there health benefits to that as well?
Yeah, infrared light is infrared and the blue rays, which we all need, and that's all coming from your sun. You got the UVB, the blue rays, and the near infrared, which are all going to set your circadian rhythm so that you can sleep, at night. And if those of you who are using devices and all that in the evening time, put your blue blockers on. Because if you keep exposing to those blue rays from the computers and cell phones, you disrupt your sleep. People don't know this, okay? Your sunlight has that blue ray that helps build the melatonin in your brain. If you keep doing blue rays throughout the evening, which is back in our ancestors and long back, they didn't do that. They all went to sleep at 7 o'clock. Sun went down, that's it, we're done. But people stay up until 12, 1, 2, with the lights on and the screen on and the whole thing going. Why can't you sleep? Because you're disturbing that whole cycle. You disturb the melatonin. The melatonin now does not come out properly. You keep blasting yourself with blue rays, and it's like the melatonin is like, okay, I'm still here. I can't get out. And don't think that taking melatonin is going to help you either. You've got to shut the lights down or dim your lights, put on blue blockers, or don't even use the devices. Don't use devices with your sleep problems. Okay? So you need to know that. All right, let's go on to a few more things here. So the macadamia nuts, very good for you. Cashews, almonds, and all these others are also very nice. Pistachios, very good for you. So include them in your diet. You're not going to eat pounds of these things, but have them as snacks, side dishes, add them to your salads. Avocados, mushrooms, and so forth. Mushrooms, I can't say enough about. They're great for reducing inflammation in the body, keeping the body in a happy state. Okay, we mentioned some of these things. Green tea with ECGC, that's epigallocatechin, 3-gallate. That's why we call it ECGC. And so that's very nice. That is an anti-inflammatory. It's actually maybe anti-cancer too. So the punicalgins in peels and fruits of pomegranate, very good for you, and so on. So just make note of these things. Rosemary has rosmarinic acid, so adding it into your foods. You can even use rosemary as an essential oil. Ginger, over 100 compounds that are helpful, including gingerol, shigoa, and all that. So just know these things. Cinnamon, cardamom, garlic, black pepper, turmeric. Turmeric has over 300 identified compounds in it. It is one of the biggest anti-inflammatory foods there is. It's phenomenal. So try to include it in your diet. But include it with bioperin, and there are some products out there that have that combination, turmeric with bioperin, because it helps absorb. Bioperin helps absorb the turmeric. So bioperin comes from black pepper. Black pepper, known as the king of spices, is wonderful, good for you. And so, use these things regularly in your food to reduce the inflammation in every part of your body. Everybody see that? Okay. Okay. First thing on the list. All you need is love, right? Okay. Love, gentleness, peace, kindness. Practice kindness. Practice random acts of kindness. It helps reduce your inflammation and the person who you're acting kindly to. You pay for somebody's bill in front of you, just make sure it's not too much, or whatever. You pay after you're walking away, and then you're going to make that person smile and reduce that person's inflammation, because that person is likely inflamed. So try to, practice these good habits. Okay, gatherings, all right? Gatherings, not separatings, not you go that way and you go that way and we never see each other, or just everybody's on a Zoom. Meet with people. We're human beings, we're social animals. Get together. Don't be only on the screens or behind a machine or whatever. Mainstream media, I would say, if you never heard it again, it's probably in your best interest. Don't bother. It's not worth it. If you know what's behind mainstream media and who's running it, yeah, you would agree, I think. And don't take any injections that have the name of a virus attached. You want to live longer? Mask wearing is unscientific. No need for it. Absolutely none. Unless you are working in specific places where it is a requirement for the sake of hygienics and so that you do not contaminate, or if someone is extremely ill and has to be transported or has to be locally contained. That's about it. Resveratrol. Forget the alcohol. Eat the berries. Have some grapes. Resveratrol. You can do it in a supplemental form, that's fine. Use these things. A CoQ10, PQQ. PQQ is pyrroloquinone, quinone. It is actually a mitochondrial builder. So we have the products that have both CoQ, PQ here. I'm recommending that now to a lot of folks. Sun chlorella, I can't say enough about that. Chlorophyll, growth factors, everything, all to your benefit. Reducing the fire. MSM, methylsulfonylmethane, we make it in our bodies, but when you have an injury or an inflammation condition, it's great. Muscle pain and joint pain, MSM. Support, exercise, clean air. Meditation, sound and movement. We do all these things here. And if you do them and practice them, you're doing yourself well. We have a hypnotherapist here, Jane Arrington. If you haven't heard about her, she's marvelous, wonderful. Our Diane, our lovely Diane, is right over there in the corner. She is our life coach, wellness coach. Will do meditation with you, show you. Carolyn is here at our facility. She's offering therapies with her centropics clouds and bubbles and everything to help protect you and to help you with your troubled body and inflammation and pain. She uses centropics cloud and the beamer. She works with the beamer also. Carolyn Z, and we have a lot more to offer here. Conventional anti-inflammatories and the potential hazards. These, again, I just need to remind you, these are in use. If they are absolutely necessary, they may be necessary for you, but try to change your program. If you don't want to be on drugs and I don't recommend them, I would say to you, it's time to, to make the change. They're not cures, they just control symptoms. They cause all kinds of nasty little things here, so be aware. Okay. So these are not things that we like to think about, but they can happen. Okay, and I'm just here as a clinician, reminding you that these things can happen to you. There are newer agents out, and again, nothing is perfect and nothing is guaranteed with any drug. Okay, so these are the final words I have for you. Now is your moment to make the change and lose the inflammation problem. Think about what you're doing at every moment of your life. If you are not thinking, if you're not awoken to these processes, you're in trouble. And you don't want to be in trouble. You want to live life happily. You have a beautiful home and family, friends. Do the right thing for your sake, for their sake, everybody working together. It's best that we do this. These are services that we offer here. I have Mary and Diane here who are going to come up now and say something, a few words. And if you have any questions, yes. Yes. Yes, I do.
Okay.
And I show you how that's done. If you come in, if you want to have a session with me, I'd be happy to show you how that's done. But intermittent fasting, yes, is probably a better way to set up your food plan and program for a healthier life. Yeah. Do you recommend fasting, intermittent fasting? Yes, this is also very, very important. Folks, thank you for your attention, and I'll have Diane and Mary come here. Yes, ma'am. On Facebook, is that what's happening, Jason? And yes, through the Om Center. Yeah, Welcome Om. Yes. Can I? Reverse arthritis? For the most part, yes. Depends on what stage you're in. But for the most part, yes, we can change arthritis to make it go away. Yeah, if you're burnt out, if you have no cartilage left, if there's some of these things are going to be very difficult to reverse, but we can really make substantial changes in your life if you have arthritis of any sort. Okay, so thank you. Thank you very much. Thank you. All right, Diana.
So we know